Thank you. So new routes to target therapy with precision drugs. I have no financial interest to disclose here. And right at the outset, I'd like to say that all these routes are in preclinical stages at present, but show us a glimpse of what is possible in the very near future. So polypharmacy. Patient adherence to glaucoma medication is a constant challenge, as you all know, and is recognized as an essential part of treatment. Contributing factors for poor compliance include difficulty of self-administering, forgetting to administer eye drops, inconvenience of frequent dosing, and unpleasant side effects. So these are the various routes by which we actually can administer glaucoma drugs, and I think only a couple of routes are explored. The others are completely left unexplored and which are on the way. In this, the challenges of implantable delivery are many, but the most common challenge is with periocular administration. So the ocular delivery systems can be divided into conventional, vesicular, controlled release, particulate, and advanced. Occusert is an insoluble insert and was first sustained release therapy, but it was discontinued due to certain disadvantages. We have bimetoprost periocular ring, silicon ocular insert that continuously releases. That's the ring on your left-hand side, which has continuously releasing bimetoprost, currently in phase 2 clinical trials, and decreases IOP to say about 18.8 millimeter of mercury at 6 months, and the ring is positioned under the upper and lower eyelids. That's how it is positioned, either upper or lower eyelids, and this is how it looks at the end stage. Intracanalicular punctal plug, hydrogel intracanalicular punctal plugs from Ocular Therapeutics delivers travoprost for 2 to 3 months, which reabsorbs and drains through the nasolacrimal system. In a phase 2 clinical trial of the depot, sustained release travoprost showed clinically significant reductions in morning IOP. The Evolute or punctal drug delivery system. So the Evolute or punctal drug delivery system from Mati Therapeutics has been tested using latanoprost in patients diagnosed with open-angle glaucoma or ocular hypertension. The Evolute's core drug allows unidirectional sustained drug elution into the tear film, thereby minimizing systemic absorption. So far, multiple multicentric US clinical trials indicate that lower punctum has retention rates up to 96% over a 12-week period. Then we have mini tablets, as you see out there in the picture, are biodegradable solid drug forms that transit into gels after application to conjunctival sac. This extends the time period of contact, which in turn increases the active ingredients bioavailability. Timolol has been used in this form. And then we have the contact lenses coated with drugs, currently in preclinical stages as replaceable drug delivery devices, nanodiamond nanogels that can be incorporated into a polyhema matrix and cast into contact lenses. Then you have the cyclodextrins, cyclic oligosaccharides, which form complexes with hydrophobic drugs, influencing their stability, availability, solubility, and tolerance. Without changing their molecular structure as carriers, they help to keep hydrophobic drugs in solution and transport them to biomembrane surfaces. In ophthalmic drugs, optimal bioavailability of the active ingredient is obtained at the appropriate concentration in aqueous eye drop solutions. The most commonly used cyclodextrin in the eye is 2-hydroxypropyl cyclodextrin, which does not cause irritation. As you see in the picture out there, you have the cyclodextrin hydrophobic group and you have the hydrophilic group with positive and negative charges, and complexes like pilocarpine with 2-hydroxypropyl cyclodextrin are well tolerated and ensure increased bioavailability in comparison to conventional ones. Then we have latanoprost. It's practically insoluble, as we all know, challenging to be formulated as an eye drop due to its poor water solubility. So propylamino beta CD has the best trade-off between latanoprost stability and availability. In vivo experiments demonstrated that this formulation led to lower ocular irritation than the commercial latanoprost. This combination formulation was also demonstrated to successfully address the main stability, solubility, and tolerance limitations of topical ocular latanoprost therapy for glaucoma. And this is how it works. So both of them actually decrease IOP equally, but the toleration is much better. The irritation is much less in this form than in the other form which is being used. So soluble ophthalmic drug inserts, they are called SODI, enhance patient compliance and ocular drug delivery in long-term glaucoma therapy in a small oval wafer developed by Soviet scientists for cosmonauts who could use eye drops in weightless conditions. This is interesting. In contact with the eye, the sodi softens in 10 to 15 seconds. The tear film turns into a viscous polymer mass in 10 to 15 minutes and then turns into a polymer within 1 hour while releasing the drug for about 24 hours. A single sodi application replaces 4 to 12 eye drops or 3 to 6 applications of ointments. So the active ingredient employed in research on sodi includes pilocarpine. So subconjunctival injections, administration of IOP lowering agents with sustained release for 3 to 4 months is another attractive alternative to daily eye drops. So this the time frame is about 3 to 4 months of delivery is constant with the frequency of routine glaucoma visits, and subconjunctival hyaluronidase injections lower the outflow resistance by up to 34% in normal eyes on an average and by up to 57% in glaucomatous eyes. Latanoprost loaded egg PC liposomes. So slow and sustained release of 60% of latanoprost was achieved by 14 days in the in vitro release study. The same formulation demonstrated a higher sustained IOP lowering effect compared with the daily administration of topical latanoprost beyond 90 days, and the egg PC liposome is injected subconjunctivally to raise a bleb, as you see out there. So this actually has been discontinued, anacortave acetate. And then we move on to intracameral biodegradable nanotechnology polymer drug delivery system using the particle replication in non-wetting templates technology. Extended release of travoprost in the anterior chamber, available in high doses. That's how it looks. And then we have the extended release of biodegradable travoprost also in this form, easily administered by a doctor in a simple office procedure. And it causes less hyperemia than the drops, and fully biodegradable and excellent safety profile. Bimatoprost sustained release. It's an intracameral implant that resides in the anterior chamber, eluting bimatoprost in a sustained manner, evenly over 6-month period. And 4 months after implantation, IOP was lowered in 92% of patients, and this reduction was sustained to 6 months in about 71% of patients. That's how it is done. As you see out there, that's a picture of the anterior chamber. That's how a slit lamp photograph through a gonioscopic lens showing an intracameral bimatoprost implanted adjacent to the trabecular meshwork. Then you have the iDose glucose is a titanium implant that is comparable in size to the company's iStent, which was used in MIGS. So the iDose is filled with a formulation of travoprost and tapped into a membrane designed to allow continuous controlled drug elution into the anterior chamber. Once depleted, can be removed and replaced again in the subsequent procedure. And it's in phase 2 clinical trial as well. And the device achieved an approximate 30% reduction in mean IOP compared to the baseline IOP. Then we have the intravitreal brimonidine implant, so shown to have protective effects on retinal ganglion cell bodies as well, and currently being tested for the safety and effectiveness of a brimonidine intravitreal implant in patients with glaucomatous optic neuropathy. This is also in phase 2 trial. And we have the newer ocular delivery devices, like we have the nano carriers, we have the nanoparticles. In nanoparticles, we have acetazolamide and pilocarpine again being tested. And this is actually a list of the implant, the material used, the drug loaded, and the duration of release. So you have a whole lot of implants that are on the way. So we really look forward to all of these. So sustained release drug formulation may be a part of the answer to the compliance problem of polypharmacy patients. Early studies have shown that better tolerability of these delivery modalities compared with topical drops, but side effects may be challenging. So the future seems to be very promising with exciting new glaucoma treatments in the horizon. Thank you.